What your nose knows about your health may surprise you. And Caroline from Atlanta, Georgia, has a question about her nose. She emails, "Dear doctors, I seem to get bloody noses without warning. It happens at work, shopping, it's even happened on a date. It's really frustrating and a bit embarrassing. What could be causing my frequent bloody noses?" And you don't want to get a bloody nose on a date.
No.
So let's talk about
that
this.
That would be a bad date. That would be a bad start. But, you know, there's a reason why the nose is probably one of the primary sources of unwanted bleeding. And there's a reason for that. Extremely rich blood supply in what we call the mucous membranes of your nose. Very sensitive. All that air is going in and out all the time. It's very susceptible to drying out. So typically, that's the #1 cause of nosebleeds, is just a simple drying out of the mucous membranes. Those vessels are superficial, they bleed. But if you're getting a lot of nosebleeds, it may be pointing to other underlying medical problems. In fact, things like leukemia, lymphoma, problems with clotting can present that way. Hypertension, high blood pressure is another, serious condition that may present as nosebleeds. Some people don't realize that if you are overusing nasal sprays, particularly nasal decongestants, this type of spray, you can irritate the mucosa, thin it to the point where you're more likely to bleed also. So they think they're doing something good for the nose, and in fact, they're making it worse.
But that's saline nasal spray, which can help prevent them. I just want to clarify that.
Okay, so what do we do? In most cases, the nose is drying out. So what we want to do, we want to moisturize it. So you're absolutely right. Using a nasal spray is a great way to go to keep it moist. Saline spray.
Unmedicated.
Unmedicated.
Right, okay.
Or using Vaseline, something just on your finger to just moisturize the end of the nose. Another thing that we want to mention, and this, I'll give you one later, Lisa, because I know you've been eyeing this. When we're young, our blood vessels, if you imagine these are these little blood vessels inside your nose, they're nice and soft and pliable. They're not as susceptible to the drying out, but as we get older, those blood vessels, see, they crack like that, a little harder to bend, that type of thing. So as we age, our nose is more susceptible to drying and cracking. Just another reason why you need to keep it moist. And here's some nice soft.
Go for it, Dr. Lisa.
Wow.
And we've said it on the show before, we'll say it again. If you're suffering from a bloody nose, the tendency is to hold your head back. That's just going to make you literally asphyxiate on all the blood going down your throat. And then, go ahead and lean forward, pinch your nose, hold it for at least 5-10 minutes. If it continues to bleed after that, that's when you definitely need to seek medical attention.